Hi everybody, this is Rhys Barber from Audiology Associates. Thanks very much for watching our earwax removal video today. Now this is a video we're going to shoot from the outside and the inside here. So you're just going to get my voice on this one. You're going to be able to see what my hands are doing whilst we're doing the actual removal itself. Now if we do use any medical terms, guys, I will pop them on the screen somewhere. It obviously depends on which platform you're watching them on, but they will appear on the screen somewhere as well. So this lovely gent come through. He's basically been suffering with his ears for a little while. But over the last month, this has been really bad. It's really blocked up in here. Very little hearing on this side. The other side, not quite so bad. Now, the first thing you'll notice, this wax is darker in color, and we've had to go almost straight away in here with the Jobson horn. Now, the reason we've had to do that is the wax is very hardened up. It's a real tough old type of wax, this one, which isn't the easiest to remove when we're looking at suction. Suction just doesn't quite get the grip it needs to be able to pull this out. So you can see I'm working really on the lateral end of the ear canal here, right at the entrance to the canal almost. Now don't forget, from our last video we talked about lateral and medial. Lateral is your outermost part, medial your more middle central part of the body then. So this is the lateral part of the canal. So we're just going in here, we're just dropping this Jobson horn over the top. Now guys, you have to sit through this one. This was such a tough one for me to do. This is probably one of the toughest ones I've done in quite a while, this one. It was a really full ear canal with some real tough old wax there, really deep, really kind of in that medial section of the ear canal, right on top of the eardrum. So not an easy one to do by any stretch. But you can see we've got this much thicker material. We're getting to this kind of softer patch here, right in the middle of this wax here. So this is a little bit more of a stickier consistency here. So I've introduced a little bit of olive oil in, and I've done that for a couple of different reasons. It's going to help me to get a better grip on the actual wax itself. And when you encounter these stickier types of wax, it does help to kind of allow that wax to disappear up the tube a little bit more effectively as well. And softer, stickier wax, it stops it from re-sticking back to the canal walls again. So just clearing the entrance away here, you can see it's coming away really nicely. There we go, just working our way down. You can see the hand movements we're making on that left hand side there. Very small hand movements, even though it seems like quite a large movement inside the ear canal. The movement you're making on the outside is really small. So we're just lifting this from the canal wall, allowing that olive oil to work its way underneath between the wax and the canal wall itself. Stops it from re-sticking. There we go, we're just trying to pull this out. The slight sort of misting or blurring you can see to the camera there is because the entrance to the canal is actually quite narrow here, and we've got quite dense cilia on the outer part. So when we've introduced the olive oil, it's stuck to those little tiny hairs. You can really see them there, which means it does tend to sort of adhere to those hairs. And as you push through them with the endoscope, then you'll get this blurring effect then on the camera itself. There we go, you can just see a little bit jumping up in front of the camera there. So we're just working our way down. We're getting to the deeper portion, this more medial portion of the ear canal now. And look at the color difference. Look at that wax. It is dark, really dark wax here. When we're looking at this darker type of wax, what we're looking at usually is an older type of wax. Wax in itself is slightly acidic, and it's that way on purpose. It stops infection from taking hold. So don't forget, this is picking up dirt, debris, skin cells inside the ear canal as well. So we want it to be able to fight any bacteria that might get in there, and that's why it goes this darker color. As it oxidizes with air, it gets this much darker appearance to it. Now you can see at the very bottom there of the ear canal a little white ridge. Now that's a bit of dead skin that we can see just underneath this wax plug here. Well done to everybody who had a go. I saw a lot of you answered the questions as far as whether we were looking at a right or a left eardrum in that particular video yesterday. Lots of you answered that one correctly. And well done to everyone who watched it on YouTube and went along and did the poll after. I think we had 2,000 votes on that poll, and 80% of you got it right. That's a pretty good score considering you're really just learning these medical terms on the channel at the moment. So you're doing really well. Clever sausages, well done. So we're just getting to this deeper section now, and this is where it gets really tough. This wax, I have a sneaking suspicion that the patient may have used some cotton buds or may have just inadvertently pushed this in just a little bit further, and what's happened here, it's impacted right down against the eardrum, which is one of the worst places you can get an impacted wax. And what you've also got is it's dry, it's hard. such a tough one to remove, this one. There is just no give in this wax at all. This was a real kind of wax battle, this one, to get this out. So we're just lifting from the side here. I'm looking for anywhere on this block of wax that I can get some purchase here. So this is the standard size Zollner tube in here. So this is the wider of the two tubes that you see us use on the channel, and that's because this gives us a much better suction grip. So if you're looking at really hard impacted wax, it's great for getting a good solid grip on that. But as much of the grip as I'm getting, it's just not budging. Now, I am always checking in with the patient at this point, making sure they're okay, they're not in any discomfort, they're not in any pain. Patient was doing really, really well, bless him. Absolute trooper, absolute trooper. So you can see I'm going all the way around the outside edge. Nothing. It's just this wax is just not giving me anything as far as any purchase there. I'm holding the suction tube in place as well. Which just allows that, obviously the suction tube is attached to a pump. So what we've got there is we're allowing that pressure to build, that suction pressure to rise, and that's going to help us get a stronger grip on this wax. But even so, this is just not budging at all. So I'm going to have to very tentatively use the Jobson horn here. Now I'm always really, really cautious when I've got to use the Jobson horn this deep, but I'm just not getting anything here. So let's just push this. Let's get rid of this surface layer. Even if I can get rid of this central section of the wax, it's going to allow me to pull the sides in then, just to really kind of fold that in from the sides. You can see we're just getting a little grip right at the bottom. Now when I'm using the Jobson horn, this is known as curettage. This is when we're using a manual tool, and when we're doing that, what I'm doing is pushing into the wax, but I'm trying not to go right down to the canal wall at the base, because I don't want to, this medial portion of the ear canal, my goodness me, it is so sensitive, and that's because this particular portion of the ear canal is surrounded by bone. This is surrounded by your skull. So what you've got here is a very, very thin epithelial layer with very little sort of fatty deposit or anything underneath it. So you're almost skin on bone, which is really ultra sensitive. If you're pressing down, it feels like a really sharp pinch or sharp scratch. I know that when we've done the videos with Taylor, he said, if you pinch the under part of your arm, that's the kind of sensation you get if you were digging down into this. So I've taken that central section away. We're now lifting this whole portion up into the center. You can see that dead skin layer underneath. So this has been here a little while. Don't forget, when we talk about this migration process in the ear canal of the skin, it's starting at the eardrum and then moving out from that point. So if you've got this sort of plug that's been really, really wedged down in there, you're going to get this little bit of skin coming through. Now you can actually see one of the blood vessels has just scraped at the bottom there, in the bottom left-hand corner of the screen. You can see a little tiny little bit of blood down there, and that's quite common when you get to this thinner skinned, deeper section here, especially when you've got tough old wax like this and it really doesn't want to budge. Just lifting from the side. Just let you know, guys, you will be seeing the lovely Taylor Green tomorrow. I'm not sure. I think we may both be able to appear on the video tomorrow. I will check to see if we're both free, and none of us got patients in, and we'll both be on the videos. But you'll be seeing him tomorrow and again next week as well, guys. So we're just getting to this bottom section. Oh yeah, sorry. If you are enjoying the videos, don't forget you can follow, subscribe, heart, like, all those things on all the different social media platforms, and that would be great. We'd love to get new subscribers. So yeah, if you've got any questions for me, drop them into the comment section. I might not answer them in the comment section, but I do try and pick out the most common ones and answer those while I'm doing the voiceovers. Medical terminology seems to have gone down really well with you guys, so we're going to carry on doing that. So yeah, stay tuned for those as well. You can see why this was tough. This is taking a long time to clear. This is taking a heck of a long time. And we've got this hard wax, but look at all that grey lining around it. Now that grey lining is dead skin that's come away from the canal wall and wrapped around this plug. So this is the reason that it is just not budging. You've got the skin, which is attached, or the surface, or the surface dry epithelial layer here that's wrapped around it, attached to the layer underneath, and then that's attached to the actual plug of wax as well. So this was an absolute a beast of a job to get this one out, and this was a really tough old time. You can see that layer of skin just coming away. Could you see that little ripple, that almost ribbon of skin that we had coming away from the suction there? That's the one. So we're just going to pull that out. There we go. We do get this ear canal nice and clear, guys, just so you know. So it was worth sticking around just to watch it till the end. And we have got the other ear canal to clear as well. Though the other ear canal wasn't quite as bad as this one, in fairness. But yeah, we're going to lift. Now we're starting to see a little bit of movement. See how it's detaching itself from the canal wall there. So it's just starting to come away a little bit now. We're going to lift. I'm trying to get that little bit of a wiggle going here as well, guys. Trying to lift this off the canal wall. That little bit of a wiggle to detach it. There you go. You can see how that portion now is detached from the section behind. I was really keeping everything crossed. That this would pull the whole section forwards. But you can see it's just not really budged there. Now we've got a slightly looser section at the top. Let's pull this away. Now, my theory is, while I'm at this point in the ear canal, that this has been pushed down so far, it's actually gone into the anterior recess and dried into that shape. So what we've got then is this bigger sort of back end, flatter back end to it, which is holding in position and stopping this front end from moving out. So I need to clear some of this extra debris here. You can see how dry this is. Little bits of hair caught in there as well. We've got everything going on in this wax at the moment. Let's start to pull this down. There we go. You can see now we're getting our first glimpse of the pars flaccida. We had our first little glimpse of the pars flaccida. Don't forget, that's the top portion of the eardrum you can see there. Let's go in that little bit further. There we are. You can see we're just trying to lift now from this bottom section. Now we've cleared a little bit of space above it. We're going to try and lift this bottom section up. Hold on to it. There we go. We're holding. There we can just, you can really see that dry skin layer that's just underneath there. We're very, very deep. We are literally on top of the eardrum at this point. You can see that skin fighting me every millimeter in here. Right, that's gone. Let's take a look behind that now. Let's just have a little look. There we go. You can see, just pulling this away. We got our first, there we go. The grey you can see just to the left of the suction tube, that's actually the pars tensa. So that's the bottom portion of the eardrum we can see there. So let's lift this down. You can see that skin pulling this forwards, trying to get this moving. It just does not want to budge. And my theory was right. What's happened here, it's been pushed, and so far it's right on top of the eardrum, but it's also in that recess, which means it's going to hold on like for dear life in there. I've popped a little bit of olive oil in now. We're just going to start to pull this forwards. Oh, guys, if you're watching this on YouTube, I will pop another poll on, just for a bit of a teaser from one of the sort of terms that came up yesterday. Let's pop a poll on for you, see how you do on that one. See if we can get a few more of you getting that one right tonight as well. Apologies last night. I told you this poll was there, and I'd scheduled it to go on, unfortunately, for the wrong day. So I realised when I started getting comments that there's no poll. So I went back on and redid it then. So I was a bit late putting it on last night. But I would promise I will schedule this one to go out tonight rather than tomorrow night like I did yesterday. So this is starting to come forwards. There we are. We can really see that section down in the recess now. We're taking surface layers off here. This is just so dry and so impacted. Such a tough old one to do. There, we're going to aim for that central section. We're going to hold on to it. Oh, it just moved a little bit, but there was a little bit too much blurring with the camera and the olive oil there, especially when we're this deep. So I've cleaned that off. We're going to go back in. You can see that blur just starting to come back through there. That's just got a grip. That bottom section, let's see if we can hold on to this. Is it going to lift? It's just, oh, there. You just saw that lift coming away there. And this is another surface layer. I'm sure there's more behind this. Let's get rid of those sections. Let's go back in now. Let's take a look. Yep. We've got that very, very deep section there. Let's try and pull this out from the top. Keep an eye on this. There. Did you see that whole section just start to move? Now we've got this away. We're getting this out of the recess there. We've got a good grip. There we go. My goodness me, this patient could hear so much better when that had gone. They were really, really pleased with how well they could hear when this started to move. There we go. Out that comes as well. These really dark, old, hard pieces. There we go. There's the eardrum. There you can see the staining on the eardrum from the oils from the wax there. It all looks very red, aggravated in there at the moment. Obviously, we were doing a lot of movement in there. Now, if you get a patient like this, we normally say to the patient, a couple of paracetamol, by this time tomorrow, that's going to feel much better. But patient could hear so much better, and that needed to come away. The longer that would have stayed in there, the harder that would have got. So this is our second ear canal here. So this patient's other ear. Just going in now, very, very different consistency, similar color, but very, very different consistency in wax here. You've got this much softer wax. Now, patient had used some olive oil on the first ear canal, but didn't really feel they had too much of a difficulty in this second one here. But you can see there's still a lot in here. You can get an appreciate for how narrow that entrance to the canal is. That's the standard size on the tube in there. There's not a tremendous amount of room to maneuver around this as well in here, but it's coming away really nicely. What we're doing here is, as I'm bringing this forwards, a lot of this is getting sucked inside the actual tube in itself. So as I'm bringing this forwards, I'm having to reposition the tube because the piece I was holding on to was broken away and got sucked inside the machine. So we've got this thicker, there you go, just as we saw there, this thicker section coming away now. There we are. You can really start to see that moving. Perfect. Out that comes. Very dark in color again. A little bit more further in there. Out that one comes as well. Looking a lot better there now. We just got a lot of this extra wax from the outside edge. Much deeper section, but we can see the eardrum beyond it, so we're just going to peel this section. Look at that dry skin and wax all coming away there in that sort of medial section of the ear canal. Out this is coming. There we go. You can really see that dry skin there. Let's take a look beyond this now. Back in. Let's take a look. Whoop. A little bit just broke away as we took this away, just at this lateral end of the ear canal, so we're just going to go past that. There we go. There's the eardrum looking so much better. Ooh, so we got 4 centimeters worth of wax, or just over 1.5 inches worth there as well. Well, guys, thank you so much for watching our video today. I hope you enjoyed it as much as I did voicing it over. If you did, subscribe, like, heart, follow, all those things. That would be absolutely fantastic. Don't forget to check out the poll on YouTube on the community tab. As always, guys, take care of yourselves, take care of your ears, and take care of one another. And I'll see you again real soon. Bye, everyone.